Good afternoon. I'm Ed Kent. I'm the Health, Safety, and Environment Coordinator for District 3, and I'd like to welcome you to our webinar on workplace health safety during COVID, Know Your Rights. I'm glad you were able to join us for this important presentation. We have 1 hour for this session and some great information to provide you. We have also want to make sure that you have a chance to ask questions as things come up during the session by using the chat function. This can be seen on the right side of your screen, and we will try to get to these as we go through the session. We will also be asking you to participate in some polls throughout the session, and these will come up on the screen from time to time. We encourage you to participate in these as it will give us a sense of how COVID-19 is affecting our members in the workplace. At the end of the session, if there is time, we will give you a chance to ask questions. Right now, everyone will be automatically muted and cannot be heard by the facilitators. But we may have a chance to hear from you later. We would encourage you to use the chat function on the side to ensure that your questions are answered. At this time, I'd like to introduce our facilitator for tonight. This is Al Bieksa. Al has an extensive experience in health and safety training. He has facilitated many health and safety courses for thousands of workers throughout the country. Currently, Al holds the position as president of USW Local 2009. Prior to that, Al was working for the BC Federation, the Health Safety Department, as the director of Return to Work Programming. Al was also Director of Training for the Ontario Federation of Labour, where he is employed for more than 22 years. Al holds many other titles. He has done extensive work creating safer working conditions for working people throughout the country. As you may know, Al is also the father of Kevin Bieksa, who was recently voted one of the Canucks all-time team players. I will turn it over to Al now.
Thanks, Ed, and it is truly my pleasure to be sharing this presentation with everybody on the call. Let's get right to it. The internal responsibility system is the underlying philosophy of the occupational health and safety legislation in all Canadian jurisdictions. Its foundation is that everyone in the workplace, both employees and employers, are responsible for the safety of all workers. Let me take you back into the late 60s. That's when the United Steelworkers began to openly criticize the lack of safety regulations, and revolutionary movements relating to safety in the workplace began to occur. The last straw came in 1974. Many of you will know the story of the uranium miners in Elliott Lake, members of the United Steelworkers, who became alarmed about the hundreds of miners who were ill or dying from silicosis and lung cancer, which the union firmly believed was caused by silica dust. Now, the union was reassured by the employer and the government that everyone was safe working in the mines, and that their work or exposures were in no way related to worker health problems. Unconvinced, the union continued to investigate and was shocked to eventually discover that the employer and the government had found another cause behind the high rates of lung cancer, radiation, and had not bothered to inform miners or to take any action to protect them. On April 18, 1974, about 1,000 miners from the Denison mine went on a 3-week wildcat strike. Now, the Ontario government was now caught in a web of lies and had to appoint a royal commission to investigate the health and safety in mines. Chaired by Dr. James Ham, it became known as the Ham Commission. The Ham Commission report included more than 100 recommendations concerning mine health and safety. Ham introduced the idea of an internal responsibility system which would require government, employers, and workers to work together to improve health and safety. And to implement this system, he advocated for the creation of joint labor management health and safety committees. This was the starting point for joint health and safety committees, and a turning point for workers, as they would now have the right to participate in the management of health and safety systems. And so the underlying principle is premised on the basis that most health and safety issues or disputes should be addressed and solved by the workplace parties themselves. The external enforcement agency would only be enlisted when there becomes a dispute that the parties cannot resolve on their own. This would, of course, apply to issues of safety created by a biological hazard, just such as the coronavirus. Now, every jurisdiction in Canada has health and safety legislation that provides general legal obligations of employers, workers, and supervisors. And regardless of the specific language in the legislation, generally employers have the legal obligation to provide a healthy and safe workplace for all workers at their workplace. And if the employer becomes aware of a hazard or an unsafe condition, they must quickly remedy the situation by either eliminating the hazard or mitigating it down to a safe level. Workers have a general obligation to work safely and to follow all safe operating procedures and to wear their personal protective equipment, PPE, properly, and also to report any hazard or unsafe condition that they identify. And last but surely not least, supervisors have a general obligation to ensure that every worker knows how to work safely, has appropriate training in all safe operating procedures, understands how and why they must wear specific PPE, that every worker is actually working safely, and that every worker is actually wearing their assigned PPE, and also investigating any report of an unsafe condition. So these three general obligations are directly applicable to issues of safety created by a biological hazard, such as the coronavirus. It is important for us on this webinar to also have feedback from you on what your experiences are. So I turn this back over to Ed Kent to conduct poll number 1.
Do we have the poll up, DJ? Here we go. So this is our first poll. We ask you all to participate. We'll give you an opportunity to answer the questions. What is the biggest health and safety concern in your workplace? And then please select one of the 5 answers. That you or your coworkers may be exposed to COVID-19, that you workplace will be shut down due to COVID-19, the uncertainty of COVID-19, lack of an effective health and safety committee, hazards other than COVID that are a danger. And so we'll give you a couple of minutes to put your answers in, and then we'll give you the results. Okay. So the results from the poll are, hang on 2 secs, sorry. My screen is a little bit wonky here. Apologize. So I apologize. I'm having issues with my screen. Okay. All right. So 45% that you or your coworkers may be exposed to COVID-19 was the #1 answer. followed by the uncertainty of COVID-19 at 27%. And then the other three questions were all at 9%. So thank you for your participation in that. I will turn it back over to Al now.
So thanks to all of the workers who have advocated for safety over the years, we can now say that every worker in Canada has three fundamental and basic rights when it comes to their own health and safety in the workplace. The first is the right to know. The second is the right to participate. And the third is the right to refuse unsafe or dangerous work. It is important that we review each of these rights in the context of COVID-19. Now, every worker has the right to know of any hazards or unsafe conditions in the workplace, and they have a right to know what precautions are in place to protect themselves from that hazard. So in the context of COVID-19, every worker has a right to know, A, how to practice hand hygiene, such as procedures of proper hand washing. Secondly, how to recognize symptoms of COVID-19 and what to do in case they exhibit symptoms. The proper cough or sneeze etiquette, how to properly disinfect tools, equipment, workstations, what routes of entry needs to be addressed to protect them from exposure, and what PPE, if any, needs to be utilized, including the procedures for proper donning, doffing, and disinfecting of the PPE. The right to know also includes knowing what preventive measures have been taken by the employer to control exposure and understanding how these measures will be enforced. Now, some preventive measures could include posting signage to alert workers of any signs and symptoms of acute respiratory illness, encouraging employees to stay home when they are sick, displaying posters promoting hand washing and respiratory hygiene, ensuring tissues and alcohol-based hand rubs are available in bathrooms and other high-traffic areas, ensuring physical distancing between workplaces, and providing proper PPE if a 2-meter distancing cannot be accomplished. Now, the second right is the right to participate. The right to participate can be exercised by an individual in choosing to be elected or appointed onto the Joint Health and Safety Committee. But that's not the only way. The right to participate also includes all other workers by bringing health and safety issues to the attention of the Joint Committee, and more importantly, having those issues addressed in an effective and timely fashion. Workers have a right to participate and to be involved in discussions relating to the control of potential exposures and including a decision that's being made on proper PPE. Let me turn it back to Ed to conduct another poll.
Ed, I'm not sure, Ed, if you're muted, but I'm just going to step in and just go through this. So our next poll question is, have you ever been a part of a workplace refusal for dangerous or unsafe work? Please select one of the following. Yes, I have refused unsafe work. I have represented a coworker who has refused unsafe work. I have thought about refusing work because it was unsafe, or I've never refused or thought about refusing unsafe work. So we'll give you a couple of minutes to type that in and we will wait for the results. Oh, wow. So it looks like 36% of you have refused unsafe work, which is pretty big. I didn't expect that. Followed by, I've thought about refusing unsafe work because I thought about refusing work because it was unsafe. And then 20% out of never refused or thought about refusing unsafe work. And 12% I've represented a coworker or who refused unsafe work. Great results, thanks. We'll go back to Al.
So the right to refuse unsafe work is a powerful tool, but a good health and safety management system should be designed to be mostly proactive to avoid situations of conflict arising over safe working procedures and potential exposures. But when the parties fail to anticipate or reach consensus on a safety matter, workers have the ability and they own the right to exercise a right to refuse unsafe or dangerous work. So I want to walk through the steps involved in a work refusal. And they're very similar in all Canadian jurisdictions. Although some provinces and territories have a little bit different procedures, essentially they're all the same. The step one in a work refusal involves a worker reporting a hazard or an unsafe condition to their immediate supervisor. At that point, the supervisor is usually required to immediately investigate the concern. Now, the supervisor, after the investigation, will report back to the worker who refused with details of how they will remedy the issue, or on the other side of the coin, disagree with the worker that the work they're being asked to perform is either unsafe or dangerous. So if the hazard or the unsafe condition is not remedied, the worker should continue to refuse. This prompts another investigation that must be undertaken, which usually includes a supervisor and a worker representative and the worker themselves. Now, the people investigating the step two, the supervisor or the worker representative, are either going to come up with a remedy for the issue or a consensus that they disagree that the work is unsafe or dangerous, which brings us to step three. So if the hazard or the unsafe condition is not remedied, again, the worker should continue to refuse. This is the point where an external health and safety enforcement agency is contacted. And the health and safety officer will also investigate the hazard or unsafe condition that was reported. And as a result of that investigation, the health and safety officer will either write orders or recommendations to remedy the issue, or they may declare that in fact the work is safe. And at this point, one way or another, the work refusal is over. There are some other fundamental principles of work refusals that should be considered. A right must be exercised by an individual person. A group of people protesting a perceived lack of attention to preventive measures is not a proper work refusal. It is more likely to be considered an illegal work stoppage and perhaps even a wildcat strike that may draw liability and possible consequences. So it's important that we understand that the right to refuse unsafe work can only be exercised by an individual. Now, the person refusing must be physically at the workplace to exercise their right. For example, they cannot exercise the right over a phone call. But most importantly, a proper work refusal should be initiated by a reasonable belief that a worker is or will be exposed to, in the context of COVID-19, a biological hazard. So let me give you some examples that may give cause for a reasonable belief. The first is the employer's not enforcing physical distancing. That is the 2 meters distance between workers. Or that the employer is not providing proper PPE to prevent accidental transmission of the virus. Or that the employer is not providing proper training for the donning, the doffing, and disinfect of the PPE. Or the employer is not addressing effectively the risk of potential exposure to COVID-19 from contractors, customers, or clients, or the people that it serves. Another example is the lack of measures adopted by the employer to prevent the transmission of COVID-19, including workplace hygiene, sharing of tools, and sharing of equipment. or a confirmed or presumptive case of COVID-19 in the workplace. There also could be concerns from employees who are particularly vulnerable. For example, they're over the age of 65, they may have a compromised immune system, or they may even have an underlying medical condition, such as a heart condition or diabetes. These are all examples of reasonable cause to believe they're being exposed to an undue hazard. Now, it's also important to remember the protection that every worker has when they exercise their fundamental rights. So when exercising any of the previous three rights that we talked about, workers also have protection from retaliation or any type of reprisal. Most health and safety legislation describes the protection as a right to no discrimination. And discrimination is usually defined as any form of discipline, reprimand, retaliation, or reprisal towards the worker, any attempts of coercion or intimidation, any example of a suspension, layoff, or dismissal, or even demotion or loss of opportunity for promotion, or any reduction in wages. And I can assure you that enforcement agencies are quick to issue quick and significant consequences to any employer guilty of discrimination. So that brings us to the end of the procedure for the right to refuse unsafe work. Let me turn it over to Ed one more time to conduct another poll on your understanding of work refusals.
All right, thank you, Al. The next poll that we have, just waiting for it to come up. Do you feel more comfortable understanding and using the right to refuse unsafe or dangerous work in relation to COVID-19? Please select one of the two answers, yes or no. So results, 88% in favor, that they feel more comfortable and understand the right to refuse unsafe work. That's great. Turning it back over to you now, Al.
Thanks, Ed. Now it's important, as we saw in the survey, that everybody feels comfortable and understands how the right to refuse unsafe work actually does operate in your jurisdiction, particularly in the context of COVID-19. But I want to go a couple steps further. On top of all our legal rights, workers have a number of effective tools and strategies that we can utilize to protect against exposure to COVID-19. A familiar tool to joint health and safety committees are risk assessments. Now, a risk assessment will help the workplace parties identify potential sources of exposure, as well as help develop effective controls, including in some cases PPE. It's important that risk assessments consider all work activities as well as non-work activities, such as arriving at work, eating lunch, coffee breaks, change rooms, etc. Now, when choosing or recommending proper controls, we should remember to always utilize the hierarchy of controls and not simply default to PPE because it's easier and less disruptive to the workplace. Remember that PPE is always the least effective of controls and therefore the least desirable. We should make sure that all efforts are made to examine practicable solutions that are higher up in the hierarchy. Now, in the context of COVID-19, on the slide I have some examples of the hierarchy of controls. So you can see, for example, accomplishing physical distancing, which is maintaining a safe distance of 2 meters or more from another person, minimizes the potential of virus droplets from a cough or a sneeze being transmitted. The droplets are typically not aerosols and are very heavy, which means they typically drop to the ground before traveling more than 2 meters. And so that's an effective control. Now, there are some effective engineering controls that we've seen, which could include the installation of plexiglass or other forms of sneeze guards that separate a worker from other people and therefore potential exposures. Now, some effective administrative controls include using fever monitoring, having people working from home if possible, and restricting access to customers, clients, or contractors. And as I mentioned before, lastly, it's PPE. The most effective PPE would be some that protects all 3 routes of entry. For COVID-19, we're concerned about routes of entry, including the eyes, the nose, and the mouth. So when we talk about effective PPE, that would include masks, goggles, face shields, and gloves, so that our hands aren't picking up the virus and transmitting it when we accidentally touch our face. Now, sometimes, not always, but sometimes there are cases where there's a dispute over which controls are the most effective, and many of you probably run into this, where the employer wants to take the cheapest and the easiest route, which isn't necessarily the most effective. So when we run into those disputes, performing a secondary risk assessment to measure the different suggested controls in relation to the original risk rating become very effective. Now, if you can see the example on the screen, when we do a secondary risk assessment, we can see that wearing a face shield, for example, reduces the risk rating to an acceptable number, whereas simply requesting a passenger to turn their head away from a worker results in no decrease of a risk rating. So again, we can use this secondary risk assessment as an effective tool to convince employers into implementing effective PPE. Now, every Joint Health and Safety Committee should be formalizing all of their recommendations. And if there's resistance at the committee level, understand that the worker co-chair should consider writing a formal written recommendation to the employer, sometimes taking the decision making to a higher level. Most legislation in our provinces and territories requires a response to the written recommendation from a committee in writing and in a specific time frame. Now, when we're performing a written recommendation, understand that it usually consists of a thorough background of the issue and safety concern and what proposals were considered, and details of the specific control and a quantitative measure of its effectiveness, and a date in which you expect a response from the employer or implementation of the recommendation. And if no response from the employer or there's an inadequate response received, the worker representative should immediately contact the enforcement agency for assistance. We know in practice that written recommendations have been quite effective, particularly in light of the COVID-19. The described process, in fact, was used by USW Local 2009 in conjunction with the Canadian National Office to achieve the provision of face shields for all airport screeners across the country. So we know that this is a proven strategy, and we highly recommend that people look into using it if they're having problems with their individual employers. Now, there's another very useful tool, and it's called a formal exposure control plan. This can be developed jointly by the Health and Safety Committee. The first step is to examine all of the work activities in the workplace to identify potential exposure to COVID-19 and determining the risk rating for that exposure. That could be a low risk rating, a moderate, or a high risk rating. And that will give us indications of what actions need to be taken. The next part of the plan includes how information relating to the risk of exposure and the controls put into place are communicated to the entire workforce. The plan should include a provision of daily update meetings and a formal record of the workers who participated in them. Now, the last part of the exposure control plan requires the committee to define all of the controls utilized, including any provision of PPE. These are quite simple. The Steelworkers District 3 has many tools that are available for anybody that wants to use them. Please don't hesitate to contact Ed Kent for access to a complete arsenal of effective tools. So as I draw to a close of this presentation, let me recognize that we're fortunate that many of us work for good employers, employers that care about the safety, the health, and the welfare of all of its employees. Good employers recognize the value of their workforce and have a willingness to invest whatever is required to keep their workforce healthy and safe. But let's be real. Some of us, unfortunately, work for employers who are only concerned about profit and management of their holdings and often treat the worker as disposable assets. Now, for these very few actors, we may have to issue them a warning. And let me suggest that the warning may sound like this. If you, our employer, do not take COVID-19 seriously and investigate all potential occupational exposures and develop an exposure plan, it is possible that you can be prosecuted for criminal negligence and spend the rest of your life in jail. If you do not heed warnings from the union, if you cancel health and safety meetings, if you fail to investigate and provide effective preventive measures, if you fail to provide proper personal protective equipment, and if just one of our members die or brings it home to their family and a family member dies, we promise you that our union will do everything in our power. It will be our lifetime goal. We will use every single resource available to us to make sure that you, the employer, spends every last day of your life in jail. The United Steelworkers fought long and hard to make changes to the Canada Criminal Code through the Westray Bill so that we can hold employers criminally accountable. And we intend to use every last bit of it. We hope that you've enjoyed this simple webinar and can take some of this information that you gained today and use it to provide the best available protection to all of our members in the United Steelworkers. Thank you for your interest. Thank you for your activism. And mostly, thank you for your dedication. Back to Ed.
Okay, thank you so much, Al. My name is Dana Sykes. I don't sound like Ed at all, and I don't know if I pulled that off earlier, but I'm the education coordinator for the district. And we do have some time for some questions. So I'm here to moderate that session. So if you could look at the side of your page, there is a panel to show questions. And I see that there might be some that have popped up. So we've got one that just came up. and this can go to either Ed or Al, we are receiving information regarding COVID for TELUS employees, but not heard if the contractors are receiving proper training with PPE. Do you know if they are? And this might not be a direct question on whether or not they are, but maybe what can we do if we don't know they are? So let's go to Ed on this question. What can we do if we don't know if the contractors are receiving the proper PPE or the proper training? Ed?
Thanks, Dana. So, yeah, it's an important question. Contractors obviously are working with our employees as well too. So the first step would be to approach the individuals and find out whether they have been given this training or not. They are working in the same area that you're working in, and if you're working with them, you know, it's a requirement that they be provided with the proper PPE and the proper training to use that PPE. So the question would be to ask those contractors whether they've received that, and if not, then the Joint Committee should contact TELUS and arrange for that training to be provided for those employees.
Thanks, Ed. Al, did you have anything you wanted to add to that?
No, I think that was a perfect answer.
Okay, great. Another question that has come through, can an employee with a compromised immune system refuse to come to work during this pandemic? And this might vary depending on what jurisdiction you're in, but let's do this again. We'll go back to Ed and then we'll hear from, or let's reverse it. We'll go to Al and then we'll hear from Ed.
Well, certainly if somebody has a compromised immune system, they're much more susceptible to not only being infected with the virus, but having much more serious consequences. Fortunately, in health and safety law right across this country, the law takes into account vulnerable workers. So that's a very long answer to a short, distinct question, succinct question. But I would say, yes, you do have a right. We also know that the government, both federally, provincially, and territorial, recognize that there are much more severe consequences for people that have compromised or underlying medical conditions. And for example, British Columbia has moved legislation, changes to the Employment Standards Act, provides job protection. And so if a person cannot go to work because of their fear of the consequences of being infected by COVID-19 because of their underlying medical condition, it's quite possible that they would also get benefits as well as job protection. So in this case here, it's not so much of having a work refusal, it's more about looking at the reality of how likely it is that they could come into potential contact with somebody who's carrying the virus.
Ed, did you have anything?
Yeah, and I think Al covered it well. I mean, certainly if you're a person in this position, I would, you know, highly recommend that you contact your health and safety committee and give your concerns to them and have them work with you to try to resolve an issue where you weren't able to come to the work site because of your health issues.
Great, thanks. There's another question here about working from home, and I know from conversations that we've been having in different forums, this has come up quite a bit. So the question here is, if the employer will not supply or allow adjustable chairs to be taken home, is there anything that could be leveraged? And this one in particular is in terms of federal legislation. So let's, yeah, if you guys have any thoughts, we'll go to Al and then Ed.
Well, I would say that the general obligations, whether it's under federal legislation under the Canada Labor Code or under provincial territorial legislation, provides a legal responsibility for the employer to ensure a safe workplace. And so if they are allowing or directing one of their employees to work from home, I would say absolutely they have an obligation to ensure that that person has the proper tools, the proper setup to ensure that they're not being put at risk by doing the work that's been assigned to them. When it comes to providing them at the employer's cost with the proper, let's say, ergonomic setup and all that, that's an area, that's a gray area of dispute with workers' compensation boards or Ministry of Labor or whatever. They are very reluctant to order the employer to have to provide ergonomic equipment. But at the end of the day, that doesn't stop the Joint Health and Safety Committee or the union making the arguments that a person needs this equipment to be able to perform the employer's work safely. And I would suggest that they can make that argument through what I described before as a written recommendation as a starting point.
And I think I think quite honestly, I mean, if the employer has asked you to work at home, you know, they have an obligation to ensure that where you're working is an adequate work site for you to work in. So I think Al's right. I mean, I think this is an issue where you address this with your health and safety committee and make some recommendations to the employer. I mean, quite honestly, not being able to bring a chair home seems to be quite an unreasonable or seems to be a reasonable request to actually to bring a chair home, and I can't see why the employer would say no to that.
So Dana, if I can add this, that if this person asking the question falls under the federal jurisdiction, this is a perfect example of utilizing, and I think it's under section 127.1 of the Canada Labour Code, which talks about an internal complaint resolution process. And therefore you can get a health and safety officer from the federal government involved and basically just making the argument, well, if they won't let me take my chair home, then how can I work safely and be in a proper ergonomic position? That's one of the tools that we used when I previously mentioned the airport screeners and our success with the steelworkers in getting face shields provided.
Great, thank you. The next question might be a bit of a tricky one because we're all in different jurisdictions, but I think this is a question about more about considering our safety and our safety of our members and being mindful of that. And I'm glad that this has come up. But this one is about our functions as local unions. And the question is, because of distancing considerations, are there any recommendations and communications for safety, recommendations on meetings and communications for safety committee members? Which is like, this is definitely a challenging time. We've learned how to do our meetings a bit differently, but what are those recommendations on how to communicate and continue having those safety meetings? So let's go to Ed, and then we'll go to Al.
Well, in a safety committee, initially one of the things that happened was a lot of employers, because of COVID-19, felt that they couldn't hold a safety committee meeting. But if you follow the proper distancing procedures, if you follow proper procedures for PPE, there is no reason why a committee could not meet, as long as you're maintaining the numbers in the room and you're maintaining proper distancing. And if that's not possible, there is the the format that we're using right now, the Go Meeting format, where you use or Zoom to conduct your meeting. So there are ways to hold this meeting, and but again, it comes back to following the proper procedures for distancing. If there's an issue with distancing in the room, then proper PPE to conduct the meeting.
So if I can add a little bit to it, I want people to remember what happened in 2002, 2003 with the SARS epidemic. And if you don't know, SARS is just another form of the coronavirus. And there was far too many people, particularly in Ontario, that died because of the terrible controls that were put into place in many workplaces and communities. And as a result, the Ontario government commissioned Justice Archie Campbell to do a report, very extensive report on how we should do better if we ever faced with a pandemic again. And one of the recommendations that Justice Archie Campbell made was to make sure that that joint health and safety committees were fully utilized to protect workers from being infected by the virus. And so I echo what Ed said previously, that we cannot afford to stop having joint health and safety committees. In fact, there should be more of an emphasis on holding meetings. They were vitally important to making sure that we stem the transmission of the virus and make sure that everybody is physically protected, but also has the comfort level that that they're not being stressed out of the potential of them getting the virus. So again, I echo what Ed talked about. There's many ways that we can have a joint health and safety committee meeting and still respect the 2-meter distancing, and we should do that.
Great, thank you. This next question, which I'm sure is pressing on many people's minds, is there any distinction between essential workplaces or other workplaces in terms of our rights with health and safety? Al, do you want to try this one?
Yes, absolutely. There is no distinction. It doesn't matter whether or not you've been deemed to be an essential service and all that. That doesn't take away from the employer's obligation to provide a safe workplace. And again, this is where we gotta make sure that we're staying on top of our enforcement agencies, because they're crucial to supporting the Joint Health and Safety Committee to make sure that everything is being done. And so just as a reminder, if physical distancing, for example, cannot be accomplished to perform a task that needs to be done, it's not okay to just say, well, we tried and we couldn't do it. You need to take the next form of control. And that would be wearing proper PPE to protect all 3 routes of entry. So again, my answer is absolutely no distinction from somebody that's been deemed as an essential worker.
Great,
Yes,
thank you.
and for sure, Al's absolutely right. There is no, an employer is obligated to provide every single employee with a safe work site. So essential or not, the obligation does not go away.
Okay, so our next question, I think this is going to be a tricky one, because I don't think we're there yet. We may not know what's going to happen, but it does highlight some of the fears that people are feeling as we start returning back for many of us and phasing back. So this question is, how can we put systems in place to prove that a workplace contagion or a death is related to COVID, and how can we prove that it has happened on the job? We represent workers who will soon be asked to go into customers' homes. Literal petri dishes, tracking vectors will become extremely difficult to trace and even more difficult to prove. Any thoughts on how that's possible to trace back to a workplace illness?
I'll take a stab at this one, Dana. This is more of, I think, a workers' compensation issue on proving causation. Very similar to what, for example, teachers have struggled with when they need to lose time from work because they've been infected by a student. And the boards right across the country are very reluctant to allow those absences as being work-related, because they feel, wrongly, by the way, that it's up to the worker to prove that they contracted that sickness, that flu or whatever, putting them off of work while they were in the course of employment. I think you've already said it, Dana, that the only way to accomplish that is to make sure you have a good tracking system. For people that are working in healthcare, not so difficult, because many jurisdictions have or are seriously considering providing a presumption to anybody that's a frontline worker that has contact with people that actually have been diagnosed with COVID-19. The tricky part becomes where typically we don't see exposure to COVID-19 in a non-healthcare facility like a manufacturing plant or another office. Although it's not the way the law is supposed to work, in reality, it will be up to the worker to prove that there's no other plausible explanation other than they contracted COVID-19 from a coworker that was diagnosed at the workplace. So documentation is extremely important to be able to prove causation in a workers' compensation claim.
Thanks. So we do have a couple more questions, and we're being mindful of time. So we will do a couple more questions, and then we'll pass it over to Ed for final statements. One of the things that has come up is just the control plan information and where can we access it. And we'll just let everybody on the call know as well that we are recording this session, so it will be available, and we will also be sharing some information and the slides afterwards, so we can follow up with you as well on where you can access additional information. The next question, the next comment comes from, well, question comment comes from another member who says, our employer says that they do not have to do anything than supply masks, rubber gloves, hand sanitizer, etc. WorkSafe has already stated that there is no real regulations on COVID-19. They say we can even have 4 in our pickups as long as we wear masks and gloves. I'm not sure what province you are in, but I know in BC that the Labour Minister did make some statements today, but I'm going to pass this over as well to Ed or Al if you have any thoughts about that.
I'm not sure what the question was, Dana, sorry.
I think it's more of a concern about employers saying, like, what can we do when the employer's saying, well, we provided you with gloves and masks, so you can do whatever you want. Like, 4 of you can go into a pickup now because we've done our job.
Okay, so I can take a stab at this. And then, as I said before in the presentation, there's a hierarchy of controls that is supported by legislation in every jurisdiction. And simply saying that we're giving you PPE, which is gloves and a mask, and in that example, you're not even protecting one of the routes of entries, which is the eyes, is definitely insufficient. The problem we have in British Columbia, not knowing where this question is, what jurisdiction the question is coming from, the problem we have in British Columbia is that we do have a regulation that requires any workplace that has a potential for occupational exposure to a biological hazard like COVID-19 to develop an exposure control plan. WorkSafe BC has chosen to not exercise the enforcement of that requirement. Instead, they've recently come out with a requirement that every workplace that is now reopening has to have what they call a safety plan. There's nothing in the legislation that requires a safety plan. The legislation requires an exposure control plan. So as part of the fight that we have as a union in protecting our members is with our enforcement agencies. And there's a number of ways that we need to hold them to task. One of those things is putting in a formal complaint with in British Columbia would be WorkSafe BC, saying that the employer has not taken all the potential precautions to protect people from exposure. And then if a prevention officer or health and safety officer comes in and refuses to write an order or recommendation, appealing the non-issuance of a recommendation or order and escalating into the appeals process. Those are ways that we are going to have to force our enforcement agencies in upholding our regulations and policies to ensure that the employer has to do more than just provide them some superficial PPE.
Thanks, Al. Oh, go ahead, Ed.
I just wanted to say that simply providing PPE doesn't resolve their obligation to do the the hazard assessment that's required to say whether this PPE is sufficient for what we're asking you to do. So it is a health and safety issue that needs to be addressed with the Health and Safety Committee. There needs to be a risk and hazard assessment completed to say that this work that we're doing with the PPE that we're being provided is actually safe. And so again, that comes back to the combined effort of the Health and Safety Committee to recognize that there are things that we need to do in a process to move forward. The direction being given is direction that these are some steps that you need to put into place to go forward. We still need to do that hazard assessment that says these steps that we've taken are the proper steps. So yeah, there's work to be done in that scenario. Just handing out PPE doesn't resolve the issue.
Great. So that's all the time that we have for questions. And before I hand it back to Ed, just to wrap it up, I want to thank everybody for the great questions, and also to Ed and Al for putting this together for us this evening. And I'll just pass it back to Ed if you have any final comments. Otherwise, as I mentioned, we will be sharing a survey or an evaluation with you following this, and we will also be sharing the slides. And we have recorded this webinar, so we will have access to this afterwards, so you can share it with your members. So back to you, Ed.
Thanks, Dana, and thank you, Al, and thank you, DJ, for helping us put this all together, and thank you for everyone that has participated tonight and has asked questions. It is a strange time that we live in today, and we need to do everything we can to ensure that our members are safe going forward. And so one of the reasons why we've been doing these right to refuse is simply because this is such a new scenario and there are so many questions around it. So thank you everyone for your participation, and thank you everyone that was involved.